Anatomy and physiology of vision. Vision is the special sense of sight that is based on the transductions of light stimuli received through the eyes. The eyes are located within either orbit in the skull. The bony orbit surrounds the eyeballs, protecting them and anchoring the soft tissues of the eye. Sight or vision is the capacity of the eye to focus and detect images of visible light on photoreceptors in the retina of each eye that generates electrical nerve impulses for varying colors, hues, and brightness. Furthermore, vision is the sense that has been studied most. Of all the sensory receptors in the body, 70% are in the eyes. Vision is the sense that requires the most learning, and the eye appears to delight in being fooled. The old expression, "you see what you expect to see," is often very true. Figure 1, the eye in the orbit. The eye is located within the orbit and surrounded by soft tissues that protect and support its function. The orbit is surrounded by cranial bones of the skull. Figure 2, extraocular muscles. The extraocular muscles move the eye within the orbit. The superior oblique originates at the posterior orbit, near the origin of the four rectus muscles. However, the tendon of the oblique muscle stretches through a folly-like piece of cartilage known as the trochlea. The tendons insert obliquely into the superior surface of the eye. The angle of the tendon through the trochlea means that contractions of the superior oblique rotates the eye medially. The inferior oblique muscle originates from the floor of the orbit and inserts into the inferolateral surface of the eye. When it contracts, it laterally rotates the eye in opposition to the superior oblique. Rotation of the eye by the two oblique muscles is necessary because the eye is not perfectly aligned on the sagittal plane. When the eye looks up or down, the eye must also rotate slightly to compensate for the superior rectus falling at approximately a 20-degree angle rather than straight up. The same is true for the inferior rectus, which is compensated by contractions of the inferior oblique. A seventh muscle is in the orbit is the levator palpebrae superioris, which is responsible for elevating and retracting the upper eyelid, a movement that usually occurs in concert with elevations of the eye by the superior rectus. The extraocular muscles are innervated by three cranial nerves. The lateral rectus, which causes subductions of the eyes, is innervated by the abducens nerve. The superior oblique is innervated by the trochlear nerve. All of the other muscles are innervated by the oculomotor nerve, as is the levator palpebrae superioris. The motor nuclei of these cranial nerves connect to the brainstem, which coordinate eye movements. Accessory structures of the eye: eyebrows, eyelids or palpebrae, eyelashes, tarsus glands, skeletal muscles, conjunctiva, lacrimal glands, nasolacrimal duct, lacrimal lake, or vital fat. Over many hundreds of thousands of years, humans lost most of the hair in their bodies. One place we haven't lost is above our eyes. So you may be wondering, why do we have eyebrows? An eyebrow is an area of short hairs above each eye that follows the shape of the lower margin of the brow ridges of some mammals. In humans, eyebrows serves two main functions. First, communication through facial expressions, and second, prevention of sweat, water, and other debris from falling down into the eye socket. It is common for people to modify their eyebrows by means of hair removal and makeup. Eyelid. An eyelid is a thin fold of skin that covers and protects an eye. The levator palpebrae superior's muscle retracts the eyelid, exposing the cornea to the outside, giving vision. This can be either voluntary or involuntary. Eyelashes. An eyelash, also called lash from the Latin word cilia, is one of the hairs that grows at the edge of the eyelids. It grows in one layer on the edge of the upper and lower eyelids. Eyelashes protect the eye from debris, dust, and small particles and perform some of the same function as whiskers do on a cat or a mouse in the sense that they are sensitive to being touched, thus providing a warning that an object, such as an insect, is near the eye, which then closes reflexively. Next is tarsal glands. Meibomian glands, also called tarsal glands, are holocrine-type exocrine glands along the rims of the eyelid inside the tarsal plate. They produce meibum, an oily substance that prevents evaporations of the eye's tear film. Skeletal muscles, commonly referred to as muscles, are organs of the vertebrate muscular system that are mostly attached by tendons to bones of the skeleton. The orbicularis oculi muscles are the main protractors or closures of the eyelids. It is a flat, ring-like band of skeletal muscles surrounding the anterior orbit composed of three parts, namely the orbital portion, the parafibral portion, and the lacrimal portion. Next one, conjunctiva. The conjunctiva is a loose connective tissue that covers the surface of the eye wall or vulvar conjunctiva and reflects back upon itself to form the inner layer of the eyelid or parafibral conjunctiva. This tissue firmly adheres to the sclera at the limbus where it meets the cornea. Lacrimal glands is located within the orbit above the lateral end of the eye. It continually releases fluid which cleanses and protects the eye's surface as it lubricates and moisturizes. These lacrimal secretions are commonly known as tears. Nasolacrimal duct. Tears ducts are another name for the nasolacrimal ducts. They form at the corner of your eye nearest your nose. They run underneath the skin and connect to your facial bones and nose. Lacrimal lake is the pool of tears in the lower conjunctival called the sac, which drains into the opening of the tear drainage system, the fonta lacrimalia. The last but not the least, the orbital fat. Prolapse is a movable yellowish mass beneath the conjunctiva, typically located in the superior-temporal quadrant. It is associated with localized weakness on thinning of tendons capsule, usually caused by aging or surgical trauma.
Outer fibrous tunic. So, the fibrous tunic is composed of the sclera and the cornea. The sclera is the white outer layer of the posterior 5/6 of the eyeball. It is a firm, opaque tissue layer that consists of dense, collagenous connective tissue with elastic fibers. The sclera helps maintain the shape of the eyeball, protects its internal structure, and provides an attachment point for the muscle that move it. Usually, a small portion of this sclera can be seen as the white of the eye when the eye and its surrounding structure are intact. And also, the bulbar conjunctiva is closely attached to the sclera. The sclera is continuous anteriorly with the cornea. The cornea is an avascular transparent structure that permits light to enter the eye. As light passes through the cornea, the light bends or refracts. Refraction of light is an important part of focusing, so the cornea is also a part of the eye's focusing system. And also, the cornea is transparent rather than white like the sclera, in part because fewer large collagen fibers and more proteoglycans are present in the cornea than in the sclera. And also, this transparent cornea occupies the front center part of the external tunic. It serves as the eye's window, which lets the light and bends its rays. Aqueous humor. The clear, watery fluid between the cornea and the front of the vitreous. Since the lens and cornea have no blood supply, the aqueous humor performs the blood's job of carrying nutrients to those structures. So, what happens if you have so much aqueous humor? So, the aqueous humor is produced behind the iris, flows into the anterior chamber through the pupil, and exits the eye between the iris and cornea. So much aqueous production causes a rise in IOP that can lead to glaucoma. So what would happen if you were to lose your aqueous humor? Aqueous humor, which is the fluid that flows into your eye, is constantly cycling within your eyes. It should flow out of your eyes and through the Dandridge angle. When there is untreated, the loss of vision may occur.
The eye itself is a hollow sphere composed of 3 layers of tissue. The outermost layer is the fibrous tunic, which includes the sclera and cornea. The sclera accounts for 5/6 of the surface of the eye, most of which is not visible. Though humans are unique compared with many other species in having so much of the white of the eye visible, the transparent cornea covers the anterior tip of the eye and allows light to enter the eye. The middle layer of the eye is the vascular tunic, which is mostly composed of the choroid, ciliary body, and iris. The choroid is a layer of highly vascularized connective tissue that provides a blood supply to the eyeball. The choroid is posterior to the ciliary body and a muscular structure that is attached to the lens by zonal fibers. These two structures bend the lens, allowing it to focus light on the back of the eye. Overlaying the ciliary body and visible in the anterior eye is the iris, the colored part of the eye. The iris is a smooth muscle that opens or closes the pupil, which is the hole at the center of the eye that allows light to enter. The iris constricts the pupil in response to bright light and dilates the pupil in response to dim light. The innermost layer of the eye is the neural tonic or retina, which contains the nervous tissue responsible for photoreception. The eye is also divided into 2 cavities, the anterior cavity and the posterior cavity. The anterior cavity is the space between the cornea and the lens, including the iris and ciliary body. It is filled with a watery fluid called the aqueous humor. The posterior cavity is the space behind the lens that extends to the posterior side of the interior eyeball where the retina is located. The posterior cavity is filled with a more viscous fluid called the vitreous humor.
Inner neural tunic. Retina is a nervous tunic of the eyeball that consists of the outer pigmented layer, which composed of pigmented simple cuboidal epithelium, and the inner neural layer, which responds to light, Retina covers the inner surface of the eyeball posterior to the ciliary body. It is located at the back of the eye. Retina is a layered tissue that transforms the light coming into your eyes to electrical signals, and these signals are sent to the brain where they are recognized as image. The vitreous gel of the human eye, also called the vitreous humor, is a transparent, colorless, gel-like substance that fills the space between the lens and the retina within the eye. It is composed of mostly water, along with a small percentage of collagen, glycosaminoglycans, electrolytes, and proteins. The human eye is divided into two segments, the anterior rudder and the posterior. This vitreous humor located in the posterior segment and fills the vitreous chamber, which takes up about 80% of the eye. Its role is to maintain the round shape of the eye, and the size and shape of the vitreous humor also ensures that it remains attached to the retina. The only structure inside the eye which are not filled with the gel are lens at the front of the eye. In back, the retina lining at the back, near the center of the retina, is the macula. The macula is the densely packed photoreceptors cells in the macula controller of the cell's central vision and is responsible for the ability to read, see faces, and distinguish detail. This has a very high concentration of photoreceptor cells that detects light. This macula is located in the very center of the retina, and in the center of macula is the fovea, which is the most important part of the eye, as it is responsible for high activation. Optic nerve. It carries information from the eye to the brain. This is also called the second cranial nerve. The function of the optic nerve is to send signal from eye to the brain, work as messenger to help us determine of what we see. It is located at the back of the eye, attached to the retina. Optic disc, the small portion of the vision field of each eye that correspond to the position of the optic disc, known as the optic nerve head. Within the retina, the optic disc is the location where ganglion cells axon exit the eye to form the optic nerve. The optic disc called the blind spot because of lack of photoreceptors, so light focus on it cannot be seen. Photoreceptors is the small cells in the eye that play a vital role in night vision and also affect how the eye sees the color. The photoreceptors located in the retina, which the light-sensitive tissue that lines the back of the eye. There are two kinds of photoreceptors, the rod and the cone. Each type of these photoreceptors works to convert different levels of light that are sent to the brain to form visual presentation. The rod photoreceptors are sensitive in dimly lit environment. It assists the eye in night vision. It contains a protein called rhodopsin that provides eye with pigmentation in low light condition. The cone receptors are activated by bright lightning and help the eye to see color. These also contain proteins called the photopsin that help create color pigments for the eye to view.
So let's proceed to the lens function. So the lens changes shape to allow focusing on various objects near or far, accommodation. So when we say accommodation, in medicine, the ability of the eye to changes its focus from distant to near objects and vice versa. This process is achieved by the lens changing its shape. Accommodation is the adjustment of the optics of the eye to keep an object in focus on the retina, as its distance from the eye varies. Lens gets more concave for image far away. Lens gets more convex for image close by for an image to appear clearly to the viewer. The image must be precisely projected on the fovea. So, lens function. The main optical function of the lens is to transmit light, focusing it on the retina. The cornea contributes about 80% of the total refraction, while the lens fine-tunes the focusing of light into the retina. So the lens is an unusual biological structure. It is transparent and biconvex, with the greatest convexity on its posterior side. The lens surface consists of a layer of cuboidal epithelial cells. In its posterior region contains very long, columnar epithelial cells called lens fibers. Cells from the anterior epithelium proliferate and give rise to the lens fibers at the equator of the lens. The lens fiber lose their nuclei in other cellular organelles and accumulate a set of proteins called crystallines. This crystalline lens is covered by a highly elastic, transparent capsule. So the lens is suspended between the posterior chamber and the vitreous chamber by the suspensory ligaments of the lens, which are connected from the ciliary body to the lens capsule.
Accommodation problem, emmetropia, myopia, hyperopia. Accommodation problem, a common problem involving accommodation is accommodate dysfunctions. This is when your eyes cannot maintain comfort or focus when accommodating, especially with near distance. This leads to blurred vision at close, especially when reading. Accommodation problems, there are three types. Emmetropia. First, is the state of vision in which a far-away object at infinity in the sharp focus with the eye's lens in a neutral or relaxed state. That condition of the normal eyes is achieved when the refractive powers of the cornea and eye's lens and the axial lens of the eye balance out, which focuses when reached exactly on retina, resulting in perfect vision. A human eye in a state of emmetropia requires no corrective. The vision scores will on a visual acuity test such as eye charts and tests. Causes of emmetropia occurs when there is perfect balance between the lens and the optical power of the eye. Not much is known about why some people's eye develops with this ideal balance while others' eye develop about long or short. Myopia or nearsightedness is a common vision condition in which you can see objects near to you clearly, but objects farther away are blurred. It occurs when the shape of your eye causes the light rays to bend, refract incorrectly, focusing image in front of your retina instead of your retina. What causes myopia? Myopia causes when the eyeball is too long relative to the focusing power of the cornea and lens of the eye. This causes lens rays to focus at point in the front of the retina rather than directly on its surface. Myopia occurs when light focuses too far in the front of the retina. Hyperopia or farsightedness is a refractive condition of the eye in which the axial lens is too short, the cornea is too flat, or the lens has too little refracted power to focus the image on the retina. The image is therefore focused posterior to the retina. This condition is corrected by addition of a plus or convex lens to the optical system, which provide additional coverage to the light rays and tiring the eyes, thereby moving the image forward to the retina. Causes of hyperopia. Hyperopia across the eyes is the short aim or the cornea is too flat. Therefore, the distance between the cornea and the retina is not long enough, resulting in image from the light rays forming behind the retina instead of coming on the retina. This causes blurred vision at the close range.
The visual pathways to the occipital lobe comprise the optic nerves, optic chiasm, optic tract, optic radiation, and the visual cortex in the occipital lobe. Nerves impulse arising in the retina travel via the optic nerves to the optic chiasm. The visual pathways begins with photoreceptor and the retina and the visual cortex of the occipital lobe. The photoreceptor are cells of two types, rod and cones. In other definition, the visual pathways is the pathways over which a visual sensation is transmitted from the retina to the brain. This includes a cornea and lens that focuses image on the retina and nerve fiber that carry the visual sensation from the retina through the optic nerves. Now, the stereoscopic vision, taken literally, has been just described as one of the glories of nature. Human can detect the disparities between the two eye images which are less than the diameter of the photoreceptor. But there are many other ways of constructing 3D depth and formation other than stereoscopic vision. When we close one eye, the most obvious change is the loss of peripheral vision on one side rather than any alteration in perceived depth. And that many people are stereo-blind without even realizing it. So let's proceed to optic nerves. As a bundle of more than 1 million nerve fiber, also known as the second cranial nerves or cranial nerve second. It is the second of several pains of cranial nerves and transmits sensory information from vision in the form of electrical impulse from the eye to the brain. A person with optic nerve damage will experience well-deserved pain when they move their eye or while resting. Vision loss is a common occurrence with optic nerve damage. Since the optic nerve link the brain with the eye, the visual acuity is affected, resulting in eventual vision loss. So, the optic chiasm is an X-shaped structure formed by the crossing of the optic nerves and the brain. The optic nerves connect the brain to the eye. To biologists, the optic chiasm is thought to be a turning point in evolution. It is thought that the crossing and uncrossing optic nerves fiber that travel through the optic chiasm develops in such a two-edged and binocular vision and eye-hand coordination. And then we have the optic tract. Is a bundle of nerve fiber that serve to carry visual information from the optic chiasm to the left and right lateral geniculate bodies in a part of the visual pathways. The key difference between optic nerves and optic tract is that the optic nerve is the nerve that connects your eye to the brain, while the optic tract is a part of the visual system of our brain. So the next is the occipital lobe. It's located at the very back of the brain and contains the primarily visual cortex, which is responsible for interpreting and coming visual information. It is the smallest lobe of the brain, accounting for around 12% of the total surface area of the brain cortex. So, when the person with a damaged occipital lobe may lead to vision impairment such as blindness or blind spot. Visual distortion is visual inattention. The occipital lobes are also associated with various behavior and function that include visual recognition, visual attention, and spatial analysis.
Vision disorders conditions. Myopia hyperopia is a common vision condition in which you can see objects near to you clearly, but objects farther away are blurry. It occurs when the shape of your eye causes light rays to bend, refract incorrectly, focusing image in front of your retina instead on your retina. Cataracts are the clouding of the lens of your eye, which is normally clear, but cataracts develop slowly over time, causing symptoms such as blurry vision. Cataracts can be surgically removed through an outpatient procedure that restores vision in nearly everyone. Glaucoma is a group of eye conditions that damage the optic nerve, the health of which is vital for good vision. This damage is often caused by an abnormally high pressure in your eye. Glaucoma is one of the leading causes of blindness for people over the age of 60. Astigmatism is a common and generally treatable imperfection in the curvature of the eye that causes blurred distance and near vision. Astigmatism occurs when either the front surface of the eye cornea or the lens inside the eye has mismatched curves. Color blindness occurs when you are unable to see colors in a normal way. It is also known as color deficiency. Color blindness often happens when someone cannot distinguish between certain colors. This usually happens between greens and reds and occasionally blues. Night blindness is your inability to see well at night or in poor light such as in a restaurant or movie theater. It is often associated with an inability to quickly adapt from a well-illuminated to a poorly illuminated environment. Scotoma is a blind spot in your vision. Depending on its size and severity, a scotoma also may look like a dark or blurry spot in your vision. Most scotomas are permanent blind spots, but some can be temporary depending on what causes them. Retinitis pigmentosa is a group of rare genetic disorders that involve a breakdown and loss of cells in the retina, which is the light-sensitive tissue that lines the back of the eye. Common symptoms include difficulty seeing at night and a loss of sight peripheral vision. Detached retina. Retina detachment describes an emergency situation in which a critical layer of tissue, the retinal at the back of the eye, falls away from the layer of blood vessels that provides it with oxygen and nutrients. Retinal detachment is often accompanied by flashes and floaters in your vision.